Each year in the United States, hundreds of people die during pregnancy. And Black women historically have experienced higher rates of pregnancy complications than any other ethnic group. So for this Closing the Gap segment, we're focusing on Black maternal health and what can be done to help save lives. I'm joined by Dr. Jaylene Sims to talk about Black maternal health. Thank you for joining me. Give me a little background about yourself.
Sure. So I'm a board certified OBGYN at Jackson Hines Comprehensive Health Center. I also work with the State Department of Health as the clinical lead for the Alliance for Innovation on Maternal Health.
Okay, so what is Black maternal health? Define it for me.
Well, in the simple form, it is basically the health and wellness related to women of African descent or Black women. But when you really think about it, Black maternal health is a movement. It is the way that we raise awareness to the inequities in maternal health between Black women and women of other descent.
Now, I was shocked to hear about this. According to the Centers for Disease Control and Prevention, Black women have the highest mortality rate in the United States when it comes to birth. Around 50,000 women in the U.S. suffer from pregnancy complications each year. But Black women are 3 to 4 times more likely to die from pregnancy-related causes than white women, especially here in Mississippi. When you hear this, what are your thoughts?
I am heartbroken because delivery, new life, pregnancy is supposed to be a beautiful thing, and it's not supposed to be associated with a death sentence. And so I have to bring light. You mentioned some of the national statistics, but I want to bring light to some of the Mississippi statistics. So between 2016 and 2020, we had 167 maternal deaths.
Wow.
4 times higher for Black women than white women.
Unbelievable.
And 80% of those were considered to be preventable. That's what breaks my heart.
Wow.
We know that there are no difference in our genes, right? There's no difference in the genes. So that leaves a few things. You have your structural racism. You also have your provider bias. And what I mean by that is women are saying that their voices have not been heard the way that maybe their white counterparts have been heard, or their concerns have not been taken seriously. And as a result, it leads to a poor outcome or a suboptimal outcome for that lady. Also, there's the social determinants of health. So when you think about the maternity deserts, when you think about where the nearest emergency room is, where is the nearest place for someone to get healthy food, where is the nearest anything in the community, you have those things that also relate to poor maternal outcomes for certain people.
What are some of the leading causes of maternal death?
So in our state, and really nationally, hypertensive diseases of pregnancy. So that's like gestational hypertension, and typically relates more to preeclampsia, which is a more severe form, which can lead to strokes and seizures, blood clots to the legs and the lungs, deep vein thrombosis or pulmonary embolus, sepsis, meaning an infection in the bloodstream, and heart disease. Some of the heart disease can be related to like patients in the pre-pregnancy state, or peripartum cardiomyopathy, where someone gains heart failure as it relates to the pregnancy state.
What are the danger signs that pregnant and postpartum moms should report to their doctors?
That is an excellent question. That is why we want to raise awareness. So some of those signs are related to things that you may experience on a daily basis, but when they're related to pregnancy, they become more severe. So headaches that are not resolved with your regular pain medicine that you use. Pain under the right breast could relate to some issues with the liver.
Wow.
Blurred vision. Those could all be signs of preeclampsia. Say you're starting to use more pillows at night in order for you to breathe better. That could be related to heart failure. If you have chest pain or issues with like one leg swelling up more than the others, along with warmth and tenderness, that could be a sign of a blood clot to the leg. Now, related to pregnancy, if you have severe pain in the abdomen or bleeding or leaking fluid, your baby not moving as much, those are all signs that should be reported to the provider. And let me tell you this, if you feel that your voice is not heard on these warning signs, shout it to the mountaintop until you find a provider that will listen to you, because you could be responsible for saving your own life and being the reporter of those issues.
Why is it so important to highlight Black maternal health right now?
Maternity and childbirth should not be considered a death sentence. We have nurse midwives that have great data surrounding their support and outcomes. We have doulas, there's community health workers, and all of those people help to build a community for the patient and help in the education, help bridge the gap in care and provide excellent education for patients to help the obstetric providers. One of the things that I want to mention that maybe a lot of lay people don't know is that hospitals are also doing things. So I know that people sometimes may be afraid to come to the hospital, but I mentioned earlier that I'm the state clinical lead for the Alliance for Innovation on Maternal Health. That is a program that has put together safety bundles to help hospitals remove the bias in care. It allows for people to see a sign, see an issue, and act. My main thing that I like to make sure everybody just remembers as the last thing is to shout it to the mountaintops. If you do not feel like your voice is being heard, find another provider who will listen, because you could save your life.
Thank you for joining us.